We want to shut down the tightness that we're seeing in the masseters
Mm-hmm.
and the tightness that we get in temporalis and that pterygoid.
Mm-hmm.
And the more we can kind of like focus on strengthening to bring the jaw
Mm-hmm.
openers back up into function,
Mm-hmm.
that's what we want to do.
Mm-hmm.
I also often find in my side of the office, and again, you kind of alluded to this with all the neck
Mm-hmm.
work that we have to do in addition to jaw. But
Mm-hmm.
typically, if we're doing our McKenzie method, we can find jaw specific directional preference movements, but we can almost be next to certain that there's going
Mm-hmm.
to have to be some repetitive movement work done in the neck. Namely, people are going to have to work on retractions to
Mm-hmm.
take that tension out of the suboccipitals that they're getting in association with the TMJ.
Mm-hmm.
Um, but going through the McKenzie method of protocol, seeing if the
Mm-hmm.
jaw has a directional preference movement, whether that's some sort of opening or a lateral slide, getting that for people to work on their own and have that therapy exercise at home,
Mm-hmm.
and then getting to work with strengthening and stabilizing over time.
Mm-hmm.
And then your treatment philosophy and assessment
Mm-hmm.
philosophy over on your
Mm-hmm.
side, little different than that though.
Yeah, a little bit different. We also do the muscle. We also put on the glove and go into the mouth and do some of that stripping of that other um, part of the masseter in there.
Yeah, and the pterygoid.
But
Yep.
it's um, not something that I've done often. So,
Same.
but
That's the same here.
yeah.
I don't do that often in practice, but when
Mhm,
it's needed, it's
mhm,
needed, right?
yeah. So with my philosophy, I start with the muscles in the back of the head and do some alternating movements a little bit, some like gentle rocking that to kind of key the body into that relaxation. So with that alternating movement that I can let go a little bit, and then I work from there around to usually the front, um, the front of the face and everything. Um, yeah, and there's yeah. So I tip, and then also probably am going to relax the muscles on the side um, before I um, move on to the TMJ. So it's usually like even if I'm going to be focusing a lot on the TMJ,
Mm-hmm.
I usually will try to loosen kind of most other structures before I get into that area area and particularly with the masseter, you can use quite a bit of pressure in that area as well, so that can also feel good. Just make sure you're keeping just onto that area, not
Right.
and then also the communication is very key. And
Yes.
then that that is probably like the biggest thing, like to make sure that it's comfortable and that it's effective and that you're really providing providing really good care and not